My name is Donna James. I am working as a physiotherapist in Aster Al Raffah WalkAgain Advanced Robotic Rehabilitation Hospital. Today I am going to introduce our rehabilitation hospital. This is our male waiting area. This is our assessment room. When the patient first comes to the hospital, we will do the assessment here. This is Syrebo. This is soft robotic exoskeletal technology. We are using for hand rehabilitation. We can do active, passive, active assisted training, and we can do individual finger training also. This is hand of hope, exoskeletal robotic hand. This is mainly we are using for hand rehabilitation. In this we have two training, CPM training and EMG triggered training. This is Huber 360. This is mainly we are using for balance assessment and training. It can also be used for strengthening. This is brain computer interface, Recoverix Pro. This is mainly we are using for three conditions: stroke, multiple sclerosis and traumatic brain injury. In this we will combine EEG based neurofeedback, functional electrical stimulation and virtual reality. This is RTMS, repetitive transcranial magnetic stimulation. This is connectomics guided RTMS, repetitive transcranial magnetic stimulation. In this, with the help of this transducer, we will deliver magnetic waves to the patient's head. This we can use in different conditions like stroke, multiple sclerosis, Parkinsonism, traumatic brain injury, CP and depression. This is cyclomotors. This we are using for both upper limb and lower limb training. In this we can do passive training, active training, and there is one another mode. This is intelligent mode. In this, if the patient is not able to do, the machine will assist the movement, but if the patient is doing by himself, he can do. This is Pablo. This is a sensor based device. We have one hand sensor and two motion sensor. This device we can use for assessment as well as training purpose. With the help of this hand sensor, we can check interdigital grip, pinch and hand grip. And with the help of this motion sensor, we can assess and train upper limb, lower limb, trunk and neck. It helps patients stand safely for therapy and recovery. Vibramoov is a neuro-rehabilitation technology in which we are using functional proprioceptive stimulation to stimulate the nervous system by using sensory stimulants with sensory information which is similar to natural movements. It has two modes. One is FPS and another one is focal vibration. Focal vibration mainly we are using for reducing the spasticity. It will provide sensory motor integration, locomotor training, and it will prevent the adverse effect of long-term immobilization. Luna EMG is an EMG based robotic device which is using for therapeutic as well as diagnostic purpose. It uses reactive EMG to train the sensory motor cortex. According to patient muscle power, we have different modes like passive mode, EMG trigger and release, EMG trigger and hold, EMG biofeedback, dynamic reversal, elastic resistance, proprioception training, etc. According to different body part, it has different extension like shoulder, elbow, forearm, trunk, knee and ankle. This is hybrid assistive limb developed in Japan by CYBERDYNE. This is the world's first brain-controlled exoskeleton. primarily used to train, support and enhance the patient's strength, and it ultimately improves the patient's quality of life and independence. Even if the patient has a flicker of movement in the lower limb, the HAL can detect these bioelectrical signals and it will assist the patient for movement. The motion principle of this machine is think, send, read, move and biofeedback. The patient thinks of a movement and the brain sends signals to the muscles. The whole detects these bioelectric signals and powers the exoskeleton to assist the patient in performing the action naturally. This is Manual X, in which we will do different type of activity to improve the hand function. This is Stella Bio. This is mainly we are using for electrical stimulation. We can do functional electrical stimulation and EMG triggered functional electrical stimulation. This is Chattanooga. This is mainly we are using for treating musculoskeletal, neurological and soft tissue disorders. Meissa OT is an advanced robot designed mainly for upper limb rehabilitation. It has 4 channels of electromyography or electrical muscle stimulation. In this we have continuous active motion, continuous passive motion and EMG triggered robotic assistive movements. It has different extensions for the training of different hand functions. With CYBERDYNE, either we will do normal rail training or the treadmill training with the help of the harness.